Welcome back. You have made it to day 6. I am so proud, and we're not slowing down. We're not slowing down at all. I am here with an incredible human being. And I'll tell you, I've never told Dr. Katie Wood this story. At the age of 24, I had a very hard time conceiving, and I went through tremendous amount of pain and doctors and treatments and surgeries and all these things just to have my beautiful daughter who's now 16. And I wish I knew this woman. I wish I knew this woman back in the day. So let me give her a proper introduction. Katie Wood doesn't need any introduction, but you're new. You're new here. So let me tell you, Dr. Katie Wood is a mother, thank God, a pharmacist, an integrative fertility coach. Now you get the story, an embodied womb practitioner. She helps women nourish their minds, bodies, and spirit for optimal fertility health, empowering them to conceive consciously and confidently with ease. And I've seen her do this time and time again. With over a decade of experience as a pharmacist and in alternative modalities, Katie is passionate about educating and guiding women through their fertility journey. She employs gentle guidance and takes a holistic approach, focusing on nutrition, lifestyle, and that mind-body connection. Welcome to the stage, Dr. Katie. How are you?
Hello, thank you so much for having me. And yes, your story just touches my heart because there's so many women, even in this day and age of social media, where there's just coaches and mentors ready to support you. And what you don't know at the time, right? You did your absolute best. So thank you so much for that beautiful introduction. And I'm just really happy to be here.
My pleasure. You know, this is very special for me to have you in the book and to have you on the summit because I think absolutely, I know more people need to know about you. And I remember going through my own fertility journey. I was a very tender age of 24, and you wouldn't think that a 24-year-old woman would have any trouble, having a baby and conceiving. And you know better than anybody that that's not the case. So there's so many different avenues to what you help women go through. So I'd love to kind of just kick us off here with first asking you, how did you transition from being in Western medicine as a pharmacist to, that journey as a holistic fertility practitioner?
Yes. So one of my favorite questions is when people ask me, how can you be a pharmacist and be holistic at the same time? And really a lot of it has to do with my own journey and very specifically our fertility journey. I was 28, coming off of 13 years of birth control use, and we were struggling to get pregnant. And I was reaching out to my OBGYN for help and guidance, and I was given nothing. Surface level, you're quote unquote healthy, just keep trying. And that's the advice that they give most women. Try for a year and then come back. And then it's basically, we're just going to usher you off to fertility treatments and not really look at the root cause of what's going on. So having that pharmacist mindset, I did a lot of research. I went down a lot of Google rabbit holes. And, finally I found acupuncture, and he was a wonderful acupuncturist. And I feel like that really helped connect me back to my body after so many years of birth control and college life and all those things. And I was able to conceive. And my beautiful daughter, Olivia, she'll be 5 this month. I don't know how that happened so quickly, but it did. And, throughout pregnancy, I was noticing like, oh, I'm not really getting a lot of nutrition advice. And actually, halfway in my pregnancy, we decided to make a very conscious decision to switch to a natural hospital birth to a home birth. So I was very fortunate to have a very empowered pregnancy and birth. And I know a lot of women don't get that opportunity, and just experiencing some Western medicine gaps in healthcare. That's kind of when I'm like, I need to step up. I need to be a stand for these women who deserve to have a beautiful, confident, empowered fertility journey, pregnancy, and birth. So here I am. There are a few other things that kind of pushed me, so to say, to jump in with both feet into fertility coaching, which you'll have to read the book to really learn about that. But in my heart, I knew that this is what I wanted to do. And I think that the universe was there to be like, okay, we're just gonna send you off and you're gonna go figure it out.
I love that so much. We just kind of stepped right into alignment. And it's so funny because, like I said, when you go through your own personal journey, you tend to be more empathetic to other people's situation. And the fact that you've gone through it, you absolutely have so much empathy, but you're backed with that education and the skill and the heart and the passion to help these women. And this is why I said we need you exposed to more people because we don't know what we don't know. Right. So yes, absolutely read the book. And we've got so much more for you today. And I know you brought a gift for us as well, which is awesome. And friends, maybe it's not you. Maybe you know someone. And that's the point here is neither one of us would have expected at a tender age of 24 and 28 to have, issues conceiving, but we did. And so I'm sure there's someone you can share this with. So, Dr. Katie, my question for you, and it might be a pretty deep, wild question, but how does the support that you offer your clients differ from what's commonly practiced in the fertility space? It's a
Hmm.
big question.
Yes. So, of course, our foundational things of nutrition, healthy lifestyle are very important. But at the end of the day, we are all energetic beings. And I think that either we don't realize that or we lose sight of that because we're in such a fast-paced world. So, yes, I do like to really make sure my clients are aware of, different things that they can be doing to fuel their body, their fertility, filling the gap with supplements where necessary, and having healthy lifestyle choices. I like to say, let's get that foundation done, but then let's look at how are we showing up in our mindset? How are we speaking to ourselves? How are we leading ourselves in our fertility journey? Are we doubting ourselves? Are we overthinking? Are we looking to external sources for the answer to finally get pregnant? I remember that that's what I was doing. Googling anything and everything. What can I do to get pregnant? What can I take to get pregnant, right? What supplement? There was even, I think that this is the wildest thing that I ordered to try and get pregnant. I found some blog, probably on Pinterest, about wild peanuts. I don't even know, wild raw peanuts. And your brain just gets so desperate and it's like, okay, I'm gonna order these peanuts and I'm going to get pregnant. No, that's not how it works. And when you're leading in that type of energy, there's a lot of scarcity. There's a lot
Yes.
of lack. There's a lot of force, gripping. You want to control. And that's very constricting to our bodies. So we want to address that. We want to be able to lead in our feminine, to be able to lean back, open ourselves up, and be able to receive, right? Being able to receive our child, abundance, creativity, just all of these beautiful things. So that's really my passion and what I like to focus on with my clients.
I love that so, so much. So I guess an extension, now that I'm just kind of hearing you and thinking, at what point in a woman's journey would they say, okay, I'm ready for Dr. Katie? What would that look like?
That's a great question. And I think it might be different for everyone. People might want to start doing this work immediately if they have a lot of self-awareness and they're like, I know I have some limiting beliefs already and some patterns. Maybe I have PCOS or endometriosis. A lot of times, things like that can come along with a lot of underlying energetic root causes. So maybe that's where you're at. Or maybe you've been trying for 6 months or a year and the doctors are pushing you to doing maybe an IUI or even IVF. And in your heart, you know that that's not right for you right now, right? That doesn't feel good or safe in your body. Then that would be a wonderful time to seek out help. And I would be more than happy to guide you on your journey.
That's amazing. we don't even think about the time that it takes us, right? I remember when I was going through IVF, I was seeing the fertility doctor, and he was an hour away from my house. And they're like, by the way, we need you here it was like every other day or every single day for X amount of time so we can track your cycle. And I'm like, you do know that I have a job, right? Like I just can't uproot my life and change my everything about my life to come here and get blood work every day for X amount of days for you to track my cycle. So this just makes so much sense. And I love how when you spoke about the OBGYN, it's like, did you get any nutritional conversation or training? And the truth is, we don't.
Mhm.
We don't. So in my head, as you're thinking, it's like, I know your expertise and I know how you help people. And I'm thinking of the female right before the stage. Maybe they have very heavy, very painful periods, and they're maybe not ready to conceive yet, right? But it's like knowing how to step into your feminine and work with you a little bit so that when you are ready to conceive, you've done the pre-work, so to
Mhm.
speak. So let's say there is a woman who's just tirelessly trying to have a family, or maybe anyone who is wanting to create that life or business of their dreams. What's your number one recommendation to them?
My number one recommendation would be wholeheartedly to slow down. We
Mm,
have to slow down. We are so much on the go. I'm guilty of it, especially in the past, but we need to slow down and be able to be with ourselves in silence, alone, without a podcast playing, without music, without a show, without checking our email or our social media, and just you can call it a meditation, you can call it mindful breathing. You can just sit with your hand on your heart, your hand on your womb if you're in a space of fertility, and just breathe and just connect with yourself, even for 5 minutes a day. And what you're going to start noticing is you're going to become more connected with your intuition, with your body, and things that are feeling hard and kind of icky right now are going to become easier because our bodies speak to us through subtle sensations, but a lot of times we're so busy we don't hear them, or we do hear them but we push them down, we suppress it, and we do not allow ourselves to feel the emotions of our day to day. We make anger and sadness and frustration to be a bad thing, but in reality being mad is no worse or better than being happy. These are all just ranges of emotions that we're allowed to feel as human beings. So slowing down so you can really connect with yourself, hear that inner voice, and begin to trust your body. I think that that's a huge issue that we have in this day and age is we are programmed really not to trust our bodies, especially as women.
mhm.
Right? We like to shame and blame our menstrual cycles and get on birth control and all of these things. And then even a woman going through menopause, right? Society doesn't appreciate a woman going through menopause. All of these stages in a woman's life are actually a huge source of our power. So being able to connect back into your body and appreciate the cyclical nature that we are as women, I think it's going to be a game changer for you. You're going to be able to connect with your desires and make choices that are in alignment with your desires. And again, if you read my chapter in the book, you will learn at least two huge instances where I literally jumped off a bridge and decided to take, that chance, that risk. But it's because I believed in myself and I believed in my body and my intuition.
I love that. Jump and the parachute will open, right?
Yes.
Uh, I remember my other question. I was talking about the nutrition piece. So you work with the woman and she does conceive. Does she then have the opportunity to stay with you through her pregnancy so that maybe you're there, locking arms to help fill the gaps.
Absolutely. Yes. I've worked with quite a few of my clients who have conceived in, in a little bit different manner. It's not necessarily as hands-on, depending on what's going on in your pregnancy, but absolutely there to support you, encourage you, and guide you because, as you know, there's lots of shifting and changing things during the pregnancy and different trimesters. And I really became passionate about all things pregnancy and birth. And I just decided that fertility was like the best and most impactful place I could be for helping women. But yes, I absolutely love helping you on your pregnancy, your birth, and your postpartum journey.
I love that. Thank God I'm past my childbearing ages. I'm really not, but I am. I've claimed it. We're done. However, you're so calming. You're so knowledgeable. You're so trustworthy. I can see, if someone were to conceive, and I've seen literally hundreds of testimonials from your clients on your Pinterest and all these other platforms where you have the proof. You've helped them create their families, and it's amazing. If I were one of those clients, I wouldn't want to let you go once I get that positive, the pregnancy test.
Oh, thank you.
So speaking of, you have brought a fertile womb embodiment. It's a 7-day immersion that you are gifting. How generous of you. Can you go into a little detail and tell us about what this is and who's it for?
Yes, absolutely. So I'm actually doing it live right now with women who have joined, but a free replay will be available. And it's, originally geared for women on their fertility journey, but really any woman. If you're a woman who has a desire to create the business or the life that you want, this can serve on so many different levels and for men too, but I specifically more work with women, but it's going to help you really be able to create that conscious awareness within your body and that presence that I was speaking about, and just being able to be. And so one example that I gave in the immersion the other day is I was outside, the sun was out, and I, had my eyes closed, just absorbing it all, feeling the sun on my skin, the warmth. I was hearing the birds outside and just like breathing and being, right? We've all heard stop and smell the roses, and that's exactly what that means. And yeah, this is going to help lead you up in small pieces, and then there's a meditative practice that's 10 minutes. It's not very long, and it's going to help you create that dialogue with your body, anchor in safety in your body, because for a lot of us, it's very uncomfortable to slow down and to be within our body from past traumas of various things that can come up. So it's going to help you move through that. And then eventually it's going to become second nature for you. It's something that's really near and dear on my heart, especially after finishing my womb embodiment certification. So I'm excited to share it with you all.
Thank you for such a tremendous gift. And you know what? If you are a woman, which if you're still listening to this, you probably are, the link to join that immersion is right below this video. And I've also gone ahead and put Dr. Katie's Instagram where she's most active, and connect with her, reach out to her, DM her. She won't bite, I promise. And also her Pinterest account is there. She mentioned Pinterest a little bit. She's got a great resource and tools and all kinds of things on her Pinterest account as well. So Dr. Katie, thank you for your time, for your knowledge, for willing to share, and just really the contribution that you brought to this day.
Thank you so much. It was such a fun conversation.
Awesome. All right, friends. Well, we'll see you in the immersion or on Instagram. You choose one or both. The links are right below this video. Have a great day. We'll see you in the next interview. Bye for now.